Hello all, I am Sujay from yoga.in. Lower back pain is one of the common ailments people worldwide face. So today we have with us Dr. Nandini. She is a certified physiotherapist and a yoga teacher. So she will discuss the treatments, causes and prevention of lower back pain. So welcome to this studio, Dr. Nandini.
Thank you, Sujay. Thank you for having me over.
That's my pleasure. So I am curious, Dr. Nandini. So how did you come to practice yoga and physiotherapy?
After I graduated, after I completed physiotherapy, I knew that I wanted to treat patients using a holistic approach to health. And that's when I did my teacher's training course. And then there was no looking back. The more I read about yoga, I got more convinced about how I'll be able to guide my patients in a better way to deal with their conditions and manage it in a better way in the long run without having to be dependent on painkillers. So that was my basic goal as to why I took up yoga after physiotherapy.
Wow, that's inspiring, really. So you must have been having patients with lower back pain. Can you tell us how lower back pain could impact one's life?
Lower back pain can range from a simple strain to a major condition, can be a degenerative condition, or can be a stress fracture, or you've had a fall and then when you take an X-ray or an MRI, you come to know that there's a nerve impingement. So it can not cause any discomfort to start affecting your daily life on a regular basis. So some patients even find it difficult to turn to one side while lying down, or can even find it difficult to stand up from a sitting position. Walking can get difficult. There can be tingling, numbness radiating down to their legs. But they have to understand what is the actual cause of the pain to be able to work on the cause and not on the symptoms.
Okay, so what are the common causes, as you pointed that?
One of the main reasons that I'm seeing in all young adults now is desk jobs, sitting for a long time, and a sedentary lifestyle. So even when you're sitting for like 6 days a week, you're at work, and then on Sundays, you just want to be chilling at home. Mm-hmm. You want to be lying down and watching TV, and there's no activity whatsoever. And we have been spoiled for choices. So bete we can order food. Amazon aa jata agle din, so we don't have to go and buy anything from the shops. Mm-hmm. So sedentary lifestyle is one of the main causes. So that can cause a lot of stiffness in the body, causes a lot of tightness in the legs, in the lower back, in the abdominal region, which can lead to lower baback pain. Someone who's been very active can also have an overuse injury.
Okay.
Or you can have an injury while you're a part of some sport, and sports injury ke wajah se bhi ho sakta hai.
Understood.
Someone who is 50 plus, ladies can have it because of post-menopausal causes. Senior citizens can have it because of degenerative causes. So there are multiple reasons for low back pain, nothing specific as such.
And how do you treat these patients? And as you are a yoga teacher and a physiotherapist, so how you inculcate yoga into your physiotherapy?
I tell this to my patients, okay? So when they come to me with a diagnosis from a doctor, the first thing I try telling them is the way an orthopedic will diagnose a back pain will be very different from the way physios diagnose back pain. So we try to understand all the causes, all the reasons that can be causing the back pain. So tight muscles, weak muscles can also be causing a nerve impingement. So we start working on the cause so that their symptoms start settling down. If we start working on the symptoms, if I start working on the tingling and the pain, I'm not working on the cause. I try to add a lot of breathing practices. So if you've seen most of the people with desk jobs, their posture will be like this when they're typing. They put so much of strain on areas that's not even required. So I try to focus on trying to let them breathe, trying to get them to relax during the sessions. Because if they don't breathe right and they're holding their breath, they're straining their neck muscles, their abdominals, their chest muscles even more. And that's just worsening the condition.
Right.
2, I try to use a lot of props during treatment. So I use a lot of belts, a lot of straps. I add pillows wherever required. So I tell them to be very mindful of the posture that they are in. For most of us, we are in so much of a hurry always. We want to try to finish the 10 counts in one position and go to the next. And we are like, kabhi hum log wo 15 exercise khatam karenge, and when do we start moving to the next activity? So I try to ask them to stay there for 30 seconds, breathe and focus on how they feel. So that's how I bring in yoga into a physiotherapy exercise.
So mindfulness is what you bring to your sessions, so
Yes.
that people take that time and
Correct.
then they focus on their therapy.
Yes.
So that's a great insight. Could you give some advices for people who are suffering from back pain? So you gave one advice to be mindful about your posture. So are there any other advices you would like to give?
First thing I would ask people to do is to understand what their trigger is. So if you feel that going to the gym and lifting a particular weight is causing the pain, then you might as well lift something lighter. Or ask the gym instructor to kind of guide you to ensure that the form is right. Or if you feel that the chair in your office is not right, you either figure out a way to add cushions or talk to your company if they can provide you with ergonomic chairs. So the first one to understand is your triggers.
Right.
2 is to listen to your body. So you know how your body responds to certain situations. Sometimes we have the tendency to push ourselves even when we are not comfortable. So you know that you're having pain, you know that you're having discomfort in a particular activity, but फिर भी करना है. You're like, हाँ ठीक है चलता है कल का देख लेंगे. So don't have that attitude. You be mindful about what you're doing today so that you're not uncomfortable, you're not in pain tomorrow.
Understood.
3rd, your back needs movement. Your body is meant to move around, so don't avoid postures. There's a tendency of people to go into bed rest, take a long leave, keep sitting the whole day if you have back pain. Avoid that. Your body needs movement. Your back needs to bend forward, bend backwards. It needs to twist, but everything in a pain-free zone. So you can't be doing these movements even when you have pain, but you do it within capacity. So I think these are the 3-4 most important advices that I would give people.
Okay, and from what age usually people tend to start this back pain?
Oh, so I have had patients who have come to me, they're 12 years and they've come to me with back pain.
Oh.
Because thanks to COVID, these kids used to go from their iPad to their phones, to watching TV, to going back to their laptops for their school classes. And the cause of the pain was simple. Ki baithe baithe, the leg muscles have become so tight that if I asked them to sit in a cross-leg position down, they were not able to do that.
Right.
Their knees used to be in air and they used to keep shuffling, not able to sit comfortably in one position. So I've had patients who, starting from the age of 12, thankfully not younger than that, to an 87, 89-year-old lady who came to me. So the causes of the pain will be very different, but that's the window.
So if one wants to prevent this lower back pain, so what one can do? Like before, maybe now you said 12 years. So what they can do to prevent such kind of...
Stay active.
Okay.
I mean, if I go back to the time when we were kids, we were never at home. If it was a Sunday, we would step down for cycling, for playing badminton. We would go out with friends, we'll keep playing and come back for lunch and go down again.
Right.
Considering the way things are now, you may not have that much of time, but make it a point to maybe have some kind of sport, get into a sport, get into some kind of maybe dancing or something that keeps your body active. Play down more rather than playing on video games at home. For people who are having a sedentary lifestyle, go down and buy groceries instead of ordering it home. Keep moving around. In office, every half an hour, 45 minutes, walk around, do some kind of joint movement. even that small movement is going to have such a big impact in your life. You're going to avoid so many complications. So moving around is something that I would suggest everyone to do.
Understood. And what about any yoga poses one can do, maybe daily or something, to avoid such kind of things? So there is Surya Namaskar, concept of Surya Namaskar in Indian yoga. So do you want to elaborate on that, or how can somebody do that?
I usually suggest everyone to do some kind of basic movements on the bed before they get up.
Okay.
So once you've woken up, some kind of straight leg raises, bending the knee and straightening it, hip rotations, bridging, okay, and maybe lying down on your abdomen and doing a simple bhujangasana. That is something that everyone is aware of.
Right.
Again, lying down on the abdomen and bending the knee and straightening. So basically what you're doing here is you're creating a lot of body movements, because once you've woken up, you've slept for 6-7 hours in one position.
Right.
So body tends to get stiff there, and then you wake up, your joints are hurting, you're feeling all the more lethargic. So this is something you can start with. But there are very basic yoga postures like Tadasana, which is like a full body stretch in the standing position. You can do Hasta Padasana, which is a forward bend, or Urdhva which is a backward bend. Either support the lower back with your hands or taking your arms up close to the ear and bending back. Like I mentioned, bridging is a good practice, straight leg raises. Simple practices, but have a major change in your body.
Thank you for this knowledge, Dr. Nandini. So again, coming back to your practice of yoga and physiotherapy, I just wanted to ask, are there any nuances of using those both together? Are there any examples where you have used that and the patients got benefited greatly?
I had a patient who had a hunched back, and she had a lot of pain radiating down into her legs.
Okay.
So the doctor had told that it's only because of the hunchback posture that her nerves are getting compressed. So we added a lot of breathing and relaxation on bolsters. So I started asking her to lie down on bolsters and do a lot of breathing techniques. So what that did is it kind of opened her chest. It created a lot of mobility in the thoracic spine or the mid back. And then she was able to slowly start straightening her, having a straight posture. But in her case, I kept giving her a lot of exercises to stretch her muscles, to strengthen her joints, plus breathing exercises, which she would do regularly. So that was one striking example that I remember when you asked me that question.
Okay, so that's great to hear that people are getting benefited from yoga postures and all. So apart from lower back pain, are there any other specific conditions where yoga is helpful for those people?
So considering lifestyle disorders in general, with the way our lifestyle is now, we have more of junk food, our sleep is not right, we are moving less, okay? So people tend to have high BP at a very young age. They have diabetes or thyroid at a very young age. So these are conditions where I've seen people who are able to manage their conditions without medicines. So they've been exercising, they've been doing a lot of pranayama and breathing techniques, and their BP has come to a normal range, and then they had to taper the medicines. Similarly, I have a lot of young girls with PCOD who have come to me, and someone who has had maybe a cycle of 40 days, 48 days, started having her periods regularly in 28 days. Just because of yoga practices, because I know that there was no other change she did in her life. You can manage post-menopausal symptoms here. Even for men also undergo a lot of hormonal changes, which is not usually addressed by doctors. There's a lot of stress relief, a lot of relaxation that comes in. Migraine, sinusitis, a lot of conditions, chest infection for that matter. Using a lot of cleansing practices, if you add that to your daily regime, you'll see a lot of difference in migraine, sinusitis and chest infection as well.
Great. So when these patients, these students come to you, do they have any kind of misconception about yoga? Have you ever faced such kind of situation?
The first thing that I get to hear is, let me get a green signal from my doctor. So I keep telling them that you don't need to have a green signal from your doctor. If you have a physiotherapist you've been going to, the physiotherapist herself can tell you if you're good to go, if you can practice yoga techniques, and which yoga practices should you be doing. Like I practice Hatha Yoga. That's very different from Iyengar Yoga. Or these are traditional practices. You have other newer practices that have been coming up now, like Power Yoga and Aqua Yoga and all. But these are all practices that will help you to improve your condition. They are not going to worsen it, obviously, if done under supervision, done under someone who can guide you better. That is the first misconception. Two is people come to me and tell me, I have never done yoga, so I'm not flexible. I don't know if I'll be able to do it.
Right.
Or मैं नीचे नहीं बैठ सकती, so how will I be able to do yoga?
Right.
You don't need to be able to sit down. You don't need to be flexible. That's the whole point of joining a yoga class.
Right.
If you're not able to do something, there's a modification. We can teach you that by sitting on a chair or lying down on a mat. The whole point is for you to do that practice without putting yourself in a lot of discomfort. So these are two main misconceptions that I've heard from people.
That's very, very interesting. And you have taken me to my next question. So that is related to the alignment, proper alignment. Because in the last answer, you mentioned that there are some modifications which you suggest when a student can't do a pose. So what is the importance of this proper alignment in yoga? And could you elaborate it from the physiotherapist perspective also?
Like I mentioned earlier, it's very important that you take a proper form or your alignment is right, and then you hold that position for 10 breaths, it's perfectly fine. But it doesn't make sense कि आपका alignment गलत है और you're holding it for a minute, because that's just going to worsen your back pain or create more conditions for you. So in that case, I would suggest using props. So use yoga blocks, use straps, use bolsters, and that is something that a lot of people feel embarrassed about. So there are a lot of people who come to my class and I tell them to not look around everywhere. That practice, you're coming to class for your own benefit. So you listen to your body, what it is telling you. बाजू वाले का body बहुत अलग है. He or she has been practicing yoga for 15 years now. You can't compare his body structure to your body structure. So if you feel for maintaining a proper alignment, you need a block, might as well take it. Or if you feel the position that we are doing is difficult, you choose a modification, choose a proper alignment instead of staying in a posture that's causing a lot of pain. Because you're not relaxing physically, nor are you mentally at peace. Full time wo 10 breaths mein you'll be constantly thinking, okay, when do I come out of this? Or if I'm focusing on stretching the legs, he'll be thinking, अरे low back में pressure आ रहा है, upper back shoulders दुख रहा है, जबकि वो parts of the body are not even at use, So it's important that alignment should be maintained.
For the yoga teachers who are certified yoga teachers, so do you have any advice to ensure that the students are having this kind of proper alignment, or if they are not, then how the teachers can address the students?
So the first thing I would tell yoga teachers is to focus on anatomy. You need to know which muscle is working, which muscle are you strengthening, which are you stretching, and kya karne se you're not worsening their back pain. Right. So know your anatomy well. Second thing is focus on breath, because even though we don't realize, we tend to hold our breath at situations either when we are stressed out or we are focusing too much on getting into a particular posture, we tend to hold our breath. And the minute I tell people, keep breathing, तभी वो लंबी सांस लेके they will exhale, because they realize they've not been breathing. Right. Okay, so that's the second thing, that you keep asking them to breathe well, breathe continuously. Right. Third thing is, like I mentioned in the previous question, ask them to listen to their body. And these are cues you keep giving. Because if you may tell them that once, but उनको वो register नहीं होता है, and when they keep hearing it, they are more mindful about what they're getting into. Right? And the next one is to walk around. In a class of say 8-10 students, if you're on your mat and you're practicing, you're doing the same practices, but you don't know what the person on the left end is doing, then that person is going to feel that he's doing it right.
Right.
जबकि maybe उनका posture बहुत गलत है, his alignment needs correction. So you walk around, you guide people individually, stop them where it's required so that they don't do anything wrong to prevent further injuries. So that is the main point, that you want people to come to you to feel better and not call you the next day and say, kal ke practice ke baad my knee is hurting. So that's the last thing you want.
Has that ever happened to you?
No, thankfully no. So I think that I'm very proud of that part. With me, the muscle soreness post an exercise is okay. It's normal. But apart from that, no injuries.
That's amazing to hear. And thank you for your time and expertise, Dr. Nandini.
Thank you, Sujay.
And we will keep it in mind, whatever you have suggested. And so for our viewers, so if they want to get in touch with you, so could you tell us about your social media handles so that they can follow you and subscribe?
Sure. So my YouTube channel is under the name of Dr. Nandini Ramachandar, and I'm on Instagram. It's Dr. Nandini Ram. So you all can follow me. Share the videos with your friends and family. If there's something that you want me to talk about, do mention in the comments so that I know what other videos I'll be able to make.
We'll keep your social media handles over here. And anybody wants to follow, they can go check out Dr. Nandini's channel. So it was nice talking to you again.
Thank you, Sujay.
And thank you for coming over here.
Thank you.
Thank you.